Good afternoon, everyone. I'm Peter Tabbins. I'm the MPP for Toronto-Danforth. I'm here with my colleagues, Franz Jelena, our health critic, Wayne Gates, our long-term care critic. We've had an opportunity to scan the regulars that have come forward. Obviously, as you have noted in some of your questions, what we're seeing is coercion on the part of the government and the setting of standards for distance that will pose huge problems to families. We're quite happy to answer any questions that you have, and we'll switch between critics so you get the most informed answer we can give you.
What else are they supposed to do? I mean, there's people in hospital who don't need to be there. What else are they supposed to do?
Franz?
So let's make that clear, that when a frail elderly person is admitted into a hospital, they will be cared for just like everybody else. They will have the right to consent. They will have the right to refuse treatment just like everybody else. All of this has been taken away by Bill 7. Now we're adding with the regulations that not only the right to be assessed has been taken away from you because you are frail and elderly, now we will be allowed to move you 150 kilometers away. What can we do to free up our hospital? So we all know that the wait times in our emergency rooms are increasing by the month. We all know that we continue to see people waiting a long time in pain for the surgery they need because the surgical capacity is not there, because there isn't enough staff to look after you. The number of people coming to our emergency have not changed that much. The number of staff working in our emergency has gone down significantly. The number of staff working in our hospitals have gone down significantly. So why do we wait longer? Because there is less nurses, less respiratory tech, less physios working in our hospital now than before. Why? Because after 2.5 years of pandemic, they are really burnt out and they feel disrespected by this government with Bill 124. What can we do? We could start to respect the hard-working healthcare workers that have been there for us for the last 2.5 years. Respect them. Number one, get rid of Bill 124. Or get rid of mandatory overtime. Get rid of working 10, 12-hour shift in a row. Nobody can do this. They burn out and then they leave our hospital and then the wait list gets longer and longer. The people who are in an ALC bed, they don't need nurses. They're cared for by PSW and RPNs. Moving them away is not going to help one person wait less in ER, is not going to help one person waiting for surgery.
Such a thing as hospital-associated disability. There's an argument made that people who are very frail and languish in hospital actually lose their mobility. They come out with worse health outcomes than being in a facility, perhaps a long-term care home where they might have access to physio, to moving around, that sort of thing. So couldn't this be seen as a positive in terms of letting seniors move around more and have a more homey lifestyle?
So I'll answer on the hospital side, you'll answer on the long-term care home side. So in many hospitals, there are recreational therapists. There are congregate living accommodation. Go in any hospital that has an intensive rehab unit, RRU, look them up. They all have those facilities already there. The people who are labeled ALC can take part in the recreation. They can take part in the congregate living, dining, etc. So is it better to be stimulated? Yes, hospitals know how to do this. Is it better to eat together than alone in your room? Yes, it is. Hospital can do this while you wait for a bed in the home of your choice.
Yeah, I'm going to discuss the travel time. I think it's absolutely heartbreaking that they're going to expect our seniors and their families to travel 70 kilometers. So in my case, from the Niagara Falls riding, that would mean somebody in Fort Erie could be placed in Hamilton or Brantford. And I challenge anybody in this room to tell me if you have a loved one that needs long-term care, you're going to want to be there. You're going to want to be able to take care of them, make sure they're getting the right medicine, make sure they're being fed. Nobody should have to travel, and nobody certainly should have to be in a hospital where they're telling you if you don't go, it's going to cost you $400 a day. I think it's absolutely terrible. This bill should be revisited so we can get rid of it. We didn't have committee hearings. Do you imagine allowing the committee hearings, allowing your family, I don't know who's been involved with long-term, coming to committee and talking about their parents or their grandparents, their mother-in-law, their father-in-law, about long-term care and why they need to be close? Now you're asking them to go 70 kilometers. If you're in the north, they're saying 150. You're looking at an hour to 2.5 hour drive to go see a loved one. It's wrong in the richest province in Ontario. What are we doing? So I'm saying very clearly, do not force seniors to go 70 kilometers away from their families. They need their families. They need their spouses. And I firmly believe, and I've said this before in the House, that if we do this, those seniors are going to die a lot sooner than what they would have if they were close to home. And the last point I'll make, the reason that you take a look at the long-term care, where they're going to send them for profit, it was mentioned in the last question, they're for-profit homes where a majority of the deaths have happened. It's a reason why the long-term care homes for profit have short wait lists, because nobody wants to go there because they're not getting adequate quick care. You take a look at a regional home that has a very short list to get into, where they're getting better care. They're not dying when they're going there. They have proper staffing. All those things mean that our loved ones are going to be taken care of, and they're going to live longer. Because at the end of the day, we want our moms and our dads and our grandparents to live as long as they can with our help. Thanks.
On a eu la confirmation aujourd'hui que en fait, il n'y a aucune garantie qu'un aîné francophone ne serait pas transféré dans un centre anglophone. On se posait la question. La réponse de la ministre était, ben écoutez, ça se peut que la personne veuille être proche de sa famille ou veuille aller dans un centre francophone. Ça veut dire, on reste chez nous en anglais ou on s'en va à Ottawa en français. Donc, c'est quoi votre réaction par rapport à ça?
La réaction, c'est que toutes les décisions qui ont été prises par ce gouvernement démontrent un manque de respect total envers les aînés. Puis quand on parle des aînés francophones, je te dirais que c'est encore pire. Oui, les listes d'attente pour les quelques maisons de soins de longue durée qui sont capables de garantir des services en français sont très longues. Mais les gens sont prêts à attendre parce que c'était une personne âgée, c'est une femme de ton temps, tu as resté à la maison toute ta vie, tu n'as jamais appris à parler l'anglais, tu veux aller en quelque part où est-ce que tu vas comprendre qu'est-ce qui se passe. Et ça, on sait très bien que on va transférer des personnes francophones dans des maisons de soins de longue durée, privées, à profit, où est-ce que personne veut aller, loin d'où est-ce qu'elle demeure. Moi, dans le nord de l'Ontario, 150 km au milieu de l'hiver, là, c'est pas un cadeau. La chance d'être transférée dans une maison francophone, il y a beaucoup plus de chances que la personne va se décourager et que va faire face à une mort beaucoup plus rapide parce qu'elle ne comprend pas qu'est-ce qui se passe puis elle se sent isolée. C'est horrible.
Can I get any of you to respond? The government said this now a couple of times, that other provinces already have this kind of first available bed thing in place. They don't seem to be monstrous societies, so can you address that? Is there anyone who could address what we're talking about here? We are the only province that has taken away the right of frail elderly people to consent to treatment. This has never been done in healthcare. It is being done here in Ontario. They will be assessed without consent. Their personal health information will be shared with long-term care home, not that they're choosing without their consent. This has never been done, and they will be shipped away up to 150 kilometers in Northern Ontario without their consent. This is not done in any other province. It has never been done, and it is not being done. So when they say that they're lying, they say they're catching up to other jurisdictions. That's what they say.
They say lots of things that, when you do the background check, doesn't hold.
So this is $400 a day versus what we previously thought to be the uninsured rate, which that's Toronto General, for example, is $1,800. So are you not pleased that it's down to $400? I know $400 is still a lot of money, but is that not a little bit of progress?
It is horrifying that now a hospital will be obligated, they don't have a choice anymore, to charge you $400 a day the day that a bed becomes available within 70 kilometers if you're in southern Ontario, or 150 kilometers if you're in northern Ontario. This is horrible. There is no hospital that has ever done this before. Were they allowed to charge? Yes. Have they done it? A few times a year under very special circumstances. It has happened. But you can count them on the fingers of one hand in a year in the province of Ontario. Now it's going to happen every single day in all 152 hospitals in every single day. $400 is, Tommy Douglas is turning in his grave right now that you would be charged $400 to stay in a hospital bed.
What did you make of Mr. Calandra's comments there? He pointed to us, in fact, and talked about this report about the $1,800 a day. He left out the fact that we asked him about the $1,800 a day, and he said, yes, sounds good, hospitals should do that. Did somebody intervene, and do you think, and bring this number down to 400? The Premier said it was ridiculous to charge 1,800. Was this a damage control that they did to bring in this $400?
Yeah, I think damage control is a fair term to use. You in the media asked them this question. I asked in the House. They would not give a figure. I think that the question became profoundly problematic for them. That was the number that was circulating. I'll point out that at $400 a day, you're talking about $3,000 a week, $12,000 a month. We're talking about a huge burden on people. And as my colleague has said, hospitals will be required to charge it. Won't be optional for them. They will be required to charge that. So yes, some damage control, but boy, the damage is huge. That's it? Okay. Thanks. Thank you very much.
Thank you.